Hey, good morning, and welcome to the UroPatient podcast. I'm your host, Vic Senese. Nice to have you here. We meet every Saturday at 10:30 a.m. Central Time on YouTube, Facebook, and X, coming to you live at 10:30. We're always available on demand, though, anytime you want at our website, UroPatient.com. Best place to go to learn more about the show. Also, best place to find all those past episodes. You can watch them all anytime you want. And here's some helpful information. I've got a bunch of handouts available. Just go and visit our website. You'll find the handouts, and there's a handout that you can run off and take home for your own use. Hey, welcome everyone, and thank you for joining me today at UroPatient.com. We're going to take a closer look at something many of us have heard for years. Do cranberries actually help prevent or treat urinary tract infections, or is it just a myth? Let's dive into the evidence together. By the end of this talk, hopefully you'll be able to explain what we know, what we don't know about cranberries and their effect on UTIs. We'll look at both prevention and treatment and discuss what advice can be reasonably offered to you. So let's start with the basics. What are UTIs? Well, their UTIs are common, especially in women. The usual suspect is E. coli, and the symptoms can be painful and disruptive. There are many risk factors, some preventable, some not. So cranberries have long been thought to help with UTIs. From juice to pills, they're marketed as a natural remedy. But what's the mechanism behind this belief? So here's the science. Compounds in cranberries called PACs, and there's the fancy word in there for you. I can never say it, so I don't even try, are thought to keep bacteria from sticking to the bladder lining. Now, if they can't stick, they can't multiply and cause an infection, or so the theory goes. Now we hit the gray area. So research results are inconsistent. Some trials show benefits, mostly in preventing recurrent UTIs, while others find little to no effect. One issue is this inconsistency in cranberry products studied. Different studies use varying forms: juices, capsules, tablets, with wide differences in dosages, frequencies, and most importantly, the level of these PACs. Many of these products lack standardization of PAC content, making it difficult to compare results or provide clear recommendations. Not all cranberry products are created equal, and effectiveness depends heavily on the quality of the formulation. Now, a major study published in JAMA in 2016, JAMA is the Journal of American Medical Association, JAMA, one of the most widely read and respected peer-reviewed medical journals in the world. It's published by the American Medical Association. It's been around since 1883, so this journal goes back. And it looked at cranberry capsules in older women in nursing homes. They found no significant difference in UTI rates between the cranberry and placebo groups, despite using a fairly high dose of PACs. Now, this high-profile publication led many clinicians to question the value of cranberry products for UTI prevention and contributed to the decline in their routine recommendations. However, critics noted that the study focused on a specific population and product type, kind of fueling the ongoing debate, prompting whether further research, including an updated review like the Cochrane Review, was necessary. So the Cochrane Review, what the heck is this? It's a type of high-quality systemic review published by the Cochrane Collaboration, an international independent nonprofit organization dedicated to synthesizing healthcare research to support evidence-based decision-making. So in 2012, they did a review and concluded there was no clear evidence that cranberry products were effective, which basically led many clinicians to move away from recommending them. However, 10 years later, they updated that in 2023 when they analyzed newer high-quality studies and found moderate certainty evidence that cranberry products, particularly capsules and tablets, can help reduce the risk of UTIs, especially in women, children, and people with bladder issues. Now, this shift renewed interest in cranberries as a use for non-antibiotic prevention option, though the importance of the product quality and PAC content remains a critical consideration. So clinical guidelines tend to be conservative. The Infectious Disease Society of America doesn't recommend cranberries for UTI prevention. The AUA Association, the American Urologic Association, says it might be reasonable in some women who experience frequent infections. While cranberry products are often used to help prevent urinary tract infections, there are several important limitations. The effectiveness of cranberries depends heavily on the formulation, dosage, and concentration of PACs. Got to look on the label. Many commercially available juices contain insufficient or inconsistent PAC levels. And added sugars can pose another health concern, especially if you're diabetic. Do you want to be drinking all this sugary cranberry juice? Now, if you like the taste of it, that's okay and you're not diabetic. Adherence can also be an issue, especially with frequent dosing of unpalatable flavors. They said that in order to get the right amount of PACs in cranberry juice, you got to drink a ton of it. And that can be kind of tough on the stomach because it is a little bit acidic. Additionally, cranberry products are not effective for treating active infections and should not replace antibiotic therapy when needed. Finally, here's a biggie. Individuals taking blood thinners like warfarin should let their healthcare providers know that they're taking this because these are over the counter. As cranberries can interact with these medications and may increase the blood thinning effect of their drug like warfarin, so it could make it too powerful. So here's what I recommend that we can tell you. If you want to try cranberries to reduce recurrence, it may help, but you should choose high-quality supplements, not these sugar-laden juices. And of course, never delay care for an active infection. Other prevention strategies may be more effective or evidence-based. Hydration, drinking, helps flush the system. And one of the things they said with the cranberry juices, drinking enough cranberry juice will also work to flush the system. But just plain old water will work just fine. And postmenopausal women may benefit from things like vaginal estrogen. I think that's something we're going to talk about in a future episode because this is something often overlooked. Another thing that we're looking at now is something called D-mannose. It's another supplement being researched with promising results. D-mannose is a naturally occurring sugar that has gained, I know, Vic, I just told everybody to not take in lots of sugar-laden products, but this is different. It's gained attention as a non-antibiotic option for preventing urinary tract infections. It works by binding to the E. coli bacteria. Now, remember, the cranberries keep it from sticking to the bladder. This one actually binds to the E. coli. And it can bind to the E. coli and prevent infections, prevent them from adhering to the wall, again, of the urinary tract, allowing them to be flushed away during normal urination. So it's kind of interesting. May even look into some D-mannose in the future. To wrap it up, cranberries are not useless, but they are not a miracle cure either. They may help in specific cases of recurrent UTIs, but only when taken consistently and in the right form. Now join us next week on UroPatient to learn more about your urologic health. Whether you're managing conditions like urinary incontinence, navigating treatment for prostate issues, or simply want a better understanding of your bladder health, I'll break down those complex topics into clear, practical information that you can use. Don't miss this opportunity to take charge of your health and get answers to your questions from a trusted expert in urologic care. All right, have a great week, everybody. See you next week.